Welcome to our video on prenatal screening for chromosomal abnormalities. Let's get started. Here's an overview of the topics we'll be discussing. Let's begin with first trimester aneuploidy screening. First trimester aneuploidy screening is performed at 12 to 13 weeks of gestation. A major component of this screening procedure is the fetal ultrasound for size of nuchal translucency. This is a dark strip full of fluid at the back of the fetal neck, and it's a normal finding in a fetus. However, an increased size of nuchal translucency indicates a high probability of aneuploidy. As for the laboratory markers, only two markers are measured in the first trimester: beta-HCG and pregnancy-associated plasma protein A. Down syndrome is associated with high beta-HCG and low PAPPA, while both Edwards and patau syndromes are associated with low beta-HCG and PAPPA. Now we'll discuss second trimester aneuploidy screening. This is performed at 12 to 13 weeks of gestation, and there are four laboratory markers measured in this trimester: beta-HCG, PAPPA, estriol, and inhibin A. Down syndrome is associated with high beta-HCG and inhibin A, and low PAPPA and estriol. In Edwards syndrome, all markers are low except for inhibin A, which may be normal. And finally, in patau syndrome, all of these markers are normal. Now let's talk about cell-free fetal DNA. This refers to the fetal DNA detectable in maternal circulation. It's an alternative test used to screen for aneuploidy. However, it's not the standard of care in all clinics yet. It has two important limitations. Specifically, cell-free fetal DNA is not used in obese women because obesity causes lower levels of cell-free fetal DNA in the maternal blood. Additionally, it's not used before 10 weeks of gestation because cell-free fetal DNA is very scarce before this time of pregnancy. We'll now discuss chorionic villus sampling, or CVS. This is performed at 10 to 13 weeks of gestation. It's an invasive procedure that obtains a sample of placental tissue to analyze the fetal karyotype and genotype. It's used to diagnose aneuploidy and screen for congenital diseases like cystic fibrosis, sickle cell anemia, Tay-Sachs disease, thalassemia, and so on. There are two approaches for CVS, either transabdominal or transcervical. As we said, CVS is a very invasive test. Therefore, it bears a significant risk for maternal bleeding or even fetal loss. Here's our overview slide again. Notice that we've discussed the first four topics. Now let's move on to the last three, beginning with amniocentesis. Amniocentesis is performed at 15 to 20 weeks of gestation. This is an invasive procedure that obtains a sample of amniotic fluid. As you can see, indications for this are the same as those for CVS. Amniocentesis is performed via a transabdominal approach, and just like with CVS, this procedure is also associated with a significant risk for maternal bleeding or fetal loss. Now let's discuss percutaneous umbilical cord blood sampling, or PUBS. PUBS is performed when there is a high suspicion for fetal anemia. It's used mostly in Rh hemolytic disease of the newborn. In this procedure, blood is taken from the umbilical vein to check fetal hemoglobin and serum bilirubin levels. It can be used not only to diagnose fetal anemia, but also to transfuse blood to the anemic fetus. Lastly, let's talk about fetal ultrasound imaging. Ultrasound is performed periodically throughout the pregnancy. It's used to check for overall fetal anatomy and pathologies like right to left or left to right cardiac shunts. It's also helpful for assessing fetal growth. Parameters measured at different times of pregnancy to assess fetal growth are gestational sac diameter, crown rump length, biparietal diameter, and the head circumference. These parameters can be used for late pregnancy dating and assessment of fetal growth. All right, let's wrap up with a question. A 37-year-old G2P1 female comes to the physician at 11 weeks of gestation for a routine prenatal visit. She has no specific complaints. Her vital signs include a temperature of 36 degrees Celsius, a blood pressure of 125 over 70 millimeters of mercury, a heart rate of 95 beats per minute, and a respiratory rate of 15 breaths per minute. The physical exam is significant for a BMI of 31. Her laboratory findings are significant for high beta-HCG and low pregnancy-associated plasma protein A. She is counseled about the increased risk for fetal aneuploidy, and she is willing to undergo more tests. Which of the following is the best next step in the management of this patient? A. Quadruple screen. B. Cell-free fetal DNA. C. Chorionic villus sampling. Or D. Amniocentesis. All right, this patient has an advanced maternal age of more than 35 years, and her beta-HCG is high, while her pregnancy-associated plasma protein A is low. This pattern of beta-HCG and PAPPA are consistent with an increased risk for Down syndrome. However, beta-HCG and PA-PPA are just screening markers, and they don't confirm any aneuploidy. Now this patient needs a confirmatory test. The test that's used to diagnose fetal aneuploidy syndrome anywhere from 10 to 13 weeks of gestation is chorionic villus sampling. Therefore, the correct answer is option C. Here is the slide that we discussed earlier, reminding us of the clinical utility of chorionic villus sampling. Now let's discuss why the other options are incorrect. Option A, quadruple screen, is a second trimester screening test. This patient is still in her first trimester, and at this point, she needs a confirmatory test rather than a screening test. Option B, cell-free fetal DNA, is incorrect because it's just another screening test rather than the confirmatory one, and this patient is also obese. Cell-free fetal DNA has a low diagnostic yield in obese women. Option D, amniocentesis, is a confirmatory test for fetal aneuploidy. However, it's performed at 15 to 20 weeks of gestation when there is sufficient amniotic fluid in the gestational sac. So again, the correct answer is C, chorionic villus sampling. And that concludes our lecture on prenatal screening for chromosomal abnormalities.